Hello everyone, I am Carla May Antonio, a Level 2 Physical Therapy student. And in this video, we will do the cranial nerve assessment from cranial nerve 1 to cranial nerve 12. And before we proceed to the assessment, I will first sanitize my hand using alcohol because I already done the hand washing. So I will sanitize my hand. Good morning, ma'am. I am Carla May Antonio, your physiotherapist for today. So for today, we will assess your cranial nerves. And this assessment will help us to assess your neurostatus. Each test is designed to target specific cranial nerves. So let's get started. So now, we are going to test the cranial nerve 1, which is the olfactory nerve, our sense of smell. So ma'am, all you're gonna do is to close your eyes, and I'm gonna put something in front of your nose, and you need to smell it, and after that, you'll tell me what it smells like. Okay?
Okay.
So ma'am, close your eyes. So what's the smell, ma'am?
It smells like peppermint.
Okay, you're right. So it means that your cranial nerve 1 is intact. To test the cranial nerve 2, we will gonna do the two tests. First is the confrontation visual field test. In order to do the test, the patient will stand in front of the physiotherapist about arm's length away. And ma'am, all you have to do is to cover up your right eye, and I will also cover up my left eye. And I want you to look just to my eye and don't look at my fingers. And I want you to tell me how many fingers you see. Okay? Are you ready, ma'am? Okay.
2, 3, 1.
Cover your left eye, and I will cover my right eye.
2, 3, 1.
And now, we will test the visual acuity using the Snellen chart. And in order to do that, the patient will stand about 20 feet from the chart. So, ma'am, do you wear eyeglasses and or contact lenses?
Yes, I wear glasses.
So, ma'am, would you mind if I would let you wear your glasses in this test?
Yes.
Okay. Okay, what we're gonna do is look at the chart over there, okay? And try to read the lowest line for me that you can read. First, you need to cover your right eye and read the lowest line for me that you can read.
E, D, F, C, Z, P.
Okay, so, ma'am, this time, cover your left eye.
E, D, F, C, Z, P.
And now, put down your hands and read that chart using your two eyes.
E, D, F, C, Z, P.
And next, we will assess the cranial nerve 3, your oculomotor, cranial nerve 4, your trochlear nerve, and your cranial nerve 6, your abducens nerve. And we will gonna do several tests to check their function. The first thing that we will gonna do is we will be looking for any involuntary shaking of eye called nystagmus, and in order to do that, we're gonna take our pen light and we're gonna hold it about 12 to 14 meters away from your nose, ma'am. And I want you to do is to keep your head still. Don't move your head and just use your eye to watch where I move the pen light. Okay. So, ma'am, just look at my eyes and you you will follow the pen just using your eyes. Okay? Next, we're gonna see how reactive the pupils are. And to do that, we're gonna dim the lights a little bit and we're gonna have the patient stare at the distant object that helps dilate those pupils. And then we're going to shine the eye of the patient using the pen light. And we're gonna see how the pupil responds and how responds to constrict, and then on the other side it should constrict as well. Okay, ma'am? So stare at that frame in front of you. Just stare that frame as I light your eyes. Okay? So let's pretend that this is a pen light. And now we will gonna test the cranial nerve 5, your trigeminal nerve. The nerve is responsible for many things like massification. So ma'am, what we're gonna do is I'm gonna let you clench your teeth like bite down. Just clench your teeth. Okay, and I should feel the massacre that is so feel. See, clench your teeth. That. And now, try also to open your mouth against resistance. Ulit, again. Again, ma'am, open your mouth against resistance. And now, we're gonna test your cranial nerve 7, which is your facial nerve. So, ma'am, can you close your eyes tightly and open them up? Close your eyes tightly, and open them up. And now, ma'am, smile for me. Try to make a frown and puff your cheek. So next, we're gonna test the cranial nerve 8, the vestibulocochlear nerve. And what we're gonna do is I will hold your one ear, and I will whisper a word on the other side, and you will need to tell me what I said. So let's begin.
Dog cat. Yogan.
The next nerve that we're going to assess is the cranial nerve 9, wherein it is your glossopharyngeal nerve. What we're gonna do is I'm gonna have you say ah,
Ah.
ah, ah, and we're gonna test your gag reflex. So I'm gonna poke a little bit and elicit your gag reflex. So let's proceed to cranial nerve 10, your vagus nerve. So ma'am, I want you to try to swallow and try coughing. Okay, so your cranial nerve 10 is intact because you can swallow and there's no hoarseness in your voice. Now, we will test the cranial nerve 11, which is the accessory nerve. So ma'am, I'm gonna have you to move your head side to side, up and down, and try to shrug against my resistance. And lastly, your cranial nerve 12, the hypoglossal nerve. Mom, what we're gonna do is just stick out your tongue and move it side to side. Okay, so your cranial nerve 12 is intact because you did that at ease.